will you be asked to show proof of vaccination? And if you don't have it, will you be asked to pay a higher price? Todd Furniss, the author of the new book, The 60% Solution, Rethinking Healthcare, is joining us now. Todd, good morning.
Good morning. How are you today?
I'm good. So we see a lot of craziness out there, at least in my opinion, all these mandates, and you can't go into this restaurant unless you show a vaccination card, and you can't go to college here unless you're vaccinated. It just seems like we live in a world where everybody is about not discriminating, but if you're unvaccinated, it's okay. Discriminate against them. So now, if somebody isn't vaccinated, are they going to have to pay more for insurance?
Well, what they've set up, what the powers that be have set up, is actually something that's different and potentially worse, which is they've said that if somebody doesn't get vaccinated, everybody's insurance goes up. And so, but it's gotten worse than that. I want to kind of alert you to a couple of things that have happened in the last 24 hours. Obviously, in some instances, we've got colleges now that are saying that if you haven't been vaccinated, they don't let you on the Wi-Fi.
Mm-hmm.
Now, I don't know how that makes any walking around sense, but this morning it was announced that doctors can now take into consideration whether or not you get treated based on whether or not you've been vaccinated.
That's unbelievable. So you're telling me if somebody is carted into the emergency room and they're unvaccinated, a doctor can walk away from them?
Quote, they're allowed to take that into consideration when considering triage, end quote.
And your thoughts on that?
I think it's horrific. I mean, what happens if somebody's already had COVID? That there's a very valid basis for not having the vaccination. What happens if you're in your first trimester of pregnancy when getting the vaccination allegedly increases the rate of miscarriage from 10% to 80%? What about if you have a religious reason? There are any number of reasons why you might not want to get vaccinated. There are legitimate medical or religious exemptions.
Or what about if you're just healthy and you take care of yourself?
Again, another good reason.
Yeah. So in your wildest imagination, did you ever see it getting to this point? If we go back to, let's even say April of 2020, October of 2020, did you ever think it would get to the point where people can make a justification for a doctor walking away from somebody who needs help because they're unvaccinated?
For me, it is inconceivable that this nation could be performing this way. I mean, it's just such a complete abdication and failure of leadership at every level. It's stunning.
Talking right now to Todd Furniss, author of the new book, The 60% Solution, Rethinking Healthcare, which offers a new vision of how to radically improve the availability and affordability of healthcare. You know, Todd, I'm with you. I sit here, and what I see is so un-American that it's hard to put into words. It's so un-American to force people to do something to combat a virus that has a 99.9% survivability rate, to combat a virus that we know who it affects, the sick and the elderly, but yet the perfectly healthy or people who just don't feel they need it are treated like lepers. It's un-American.
Well, there's one more category that is very politically correct not to include in the people who are most adversely affected, and that is people who are obese.
Mm-hmm.
People who are smokers. But particularly those two categories are very vulnerable. This is a cardiopulmonary disease, and the CDC's own report said that 78% of those people who are hospitalized or intubated with COVID or died from COVID were obese.
Mm-hmm.
Now, how many times have you heard, I haven't heard word one about, hey, time to get some exercise. Hey, time to get rid of that obesity problem you have. Hey, time to tackle your weight. Haven't heard it once. But 78% of the people who are dying or intubated, meaning they're acutely medically taken care of, those people are obese. Now, why aren't we talking about that?
Because that's not going to be something that's touched. It's just easier to sit there and look at people and say, you're not vaccinated, you're the problem. And that's what we have right now. It's well, you're not vaccinated. And I see people who are vaccinated getting the virus and spreading the virus. And then you hear, well, they don't get it as bad. Okay, that's great. That's fine. And Todd, I'm not anti-vaccine. You know, I feel like I need to say that all the time. I'm pro-choice. It should be a choice.
I completely agree with you, and I am not anti-vaccine either. I think you should get the vaccine if it's medically the right thing to do for you.
Right.
But what we shouldn't have is a situation where you're you're arm wrestled into submission and forced to get a vaccine that may not be appropriate for you.
I couldn't agree more. Todd, always a joy having you on the show. Thank you.
Thanks so much for having me.